Good morning. Welcome to the virtual Staff Town Hall meeting. I am Tanya Jones, Vice Chair of Staff Council, and it is my honor to serve today as your moderator. I want to begin with explaining the program and the format today. The speakers today will be Mr. George Jones, and then followed by Dr. Bro, and then Mr. Wade Henley, Associate Vice President for Auxiliary Services, and then I will go into the Q&A portion of the questions today that you have submitted previously, and then you will have the opportunity to submit questions during this entire event, and I will go in turn as the questions were received. So why don't we begin? I would like to turn the program over to Mr. George Jones, who is the Chair of Staff Council. Mr. Jones?
Good morning. Good morning, colleagues. Good morning, staff of Bowie State University. It's a pleasure this morning to speak with you. As you can see, I'm here teleworking, working hard teleworking, as some of you are, and some of you, of course, are on the campus. So it's a pleasure to see you virtually this morning and to greet you and welcome you to this very important staff town hall. As I communicated to staff council members, there will be a great deal of very important information that will be distributed today. So having said that, again, welcome to you all staff of the university, including those who are staff council and those who are not staff council members, all staff. But having said that, it gives me a great deal of pleasure to introduce this morning to you that someone who really doesn't need an introduction, but certainly I'm going to give her a great one, hopefully. But nonetheless, I want to introduce you to the greatest president in academia. So please help me welcome and for the information session and her opening remarks, Dr. Amenta Bro. Dr. Bro, good morning, and thanks so much for providing this town hall for us today.
Well, good morning, and thank you, Mr. Jones. Thank you, Ms. Jones, for helping to coordinate today's session. It is so very important that we come together as a campus community and share information, especially during these unprecedented times, especially today, as it is very messy outside. And so I'm hoping that everyone is safe and sound and indoors today as we're enduring some inclement weather. As we begin this session today, I would like to start in a unique way. These are unprecedented times, and COVID-19, along with the other crises we have faced as a campus community and as a nation, has greatly impacted everyone on our campus and in our community as we face COVID-19 as well as racial and social injustice in our country. And I think it's important as we think about the work that lies ahead for us in this next year during these times of uncertainty, we take assessment and we come together as a community to reflect on what this has meant to each and every one of us. Everyone has been impacted. And as you look at the screen, you see that there is a vision and an image that I took as I arrived onto the campus recently, and I looked at that site and I thought about what this means for all of us in this next year, that we are working together as one community on this pathway. And I want us to keep this image in our minds to help guide us in our thinking, in our planning, and in our decision making for this next year as we do the work on behalf of our students and making sure that they have the pathway forward to success. So as we begin today, and before I give further remarks, I would ask that everyone on this call first take a moment of silence to reflect on where we are today and the work that lies ahead, and those who have been impacted, some experiencing loss, some experiencing health issues, some experiencing the impact felt through the social justice issues that we've seen across this country. So let's just take one moment out to have a moment of silence. Thank you. Thank you, everyone. I appreciate that. For today, I'd like to outline what you can expect and the goals that we've set for this session. On the next slide, you will see that for today's session, there are 4 goals. One is to clarify the process for the return to campus plan, to make sure everyone understands where we are in our process and how we have been thinking about the decision making that's happening here on the campus. Next, to provide an update on the implementation of our model, which we call the hybrid first-year intensive model, and what that means and where we are in the implementation. Third, provide an update on the safety measures. I know many of you have questions, we all do, about what this new normal means for our campus and what we're doing to ensure that we have addressed the safety and sanitation measures for the physical campus, as well as other measures we're taking to ensure that our campus and every campus community member feels that sense of safety and what we're doing to mitigate the risk to the extent that we can. And then finally, we want to allow enough time to just listen and hear what your concerns or questions might be and where you are in your thinking about our plans for the fall semester and what lies ahead. So with that, let me go to the next slide. The hybrid first-year intensive model, there's a lot of information that's up on the COVID-19 webpage, and I hope that you've been reading to keep abreast of how this process has been moving forward, the decision-making that's been happening, to make sure that you know where we are in the process. And there's a weekly update that goes out. It's going out every Wednesday now, to give you as much information, up-to-date information as we know it at the time. So I would invite you, if you haven't already done so, please make sure that you read through the information that's already been put up. And could I ask everyone to mute, please? I hear some noise in the background. I just want to make sure everyone's able to hear me clearly. So I want to make sure that we continue to keep our campus community in touch with what's happening, because every day that I wake up, there's something new. There's new information, and the administration and all of our working teams are taking that information and utilizing it to help with our planning and improving our planning process and navigating, and if we need to, making changes to improve our plans for the future. So the essential decision-making elements that have guided us in our thinking about this plan that we have today, the hybrid first-year intensive model, I want you to know that it's driven by, first, the science. We need to be informed by the science. I know there's a lot of misinformation out there, a lot of confusing information, but know that the administration and our working teams, and by the way, there are 25 working teams made up of faculty, staff, and students in our shared governance representation, making decisions, working hard behind the scenes to drive and implement this plan. And we start with the science. And by science, I mean looking to the science experts, the CDC, the Centers for Disease Control, number one. Looking to the science with our local experts, our public health officials, looking to the experts on our own campus. And I want to applaud Dr. Rita Wuta, who is very much at the top of the planning process, working with our campus project managers, along with Dr. Demetrius Johnson, who is the emergency response coordinator. They are working diligently, gathering the information on the science that informs our decision making. You have to start with the science and make sure we know what that is telling us about wearing masks. You know, there's been a lot of confusion out there, but I want you to know, if you don't remember anything else today, wear your mask. It is a requirement today, but it's based in science. We don't just make decisions. We are going back to the science that tells us that wearing a mask helps to stem the spread of the virus. So please, wherever you are, on campus or off campus, wear your mask, wash your hands, and practice social distancing. That's what the science tells us today, and we need to make sure that we stay focused on the science. Next, we are data-driven. Every day we are looking at the data with the number of cases that are out here every day. The numbers are changing, and we pay attention to what's happening in the country, what's happening in our region, what's happening in our state, and what's happening locally for Prince George's County, because that's extremely important for our population to know what is happening for those who are coming to the campus in our region and locally. And our data is informed by the information that we get from the county, and you yourself can go on to the websites that provide updates on a daily basis through the CDC and through our local public health department and the state that shows us the number of cases so that you can know where things are and be informed as you need to make decisions in this planning process and what's going to make sure that you are doing what is in the best fit and in the right direction for you. And so what the data tells us, and Dr. Demetrius Johnson can speak to this a little bit more later on in the program, what the data tells us is that we have seen a recent spike post July 4th in our local data, and telling us that there was a spike in the number of cases. Prior to that, we were making good progress in Prince George's County and across the state because there were early decisions that were made by the state to go into, as we all know, the stay-at-home orders. And people were practicing safety precautions. And so we saw a decline in the number of cases that were happening across the state and in Prince George's County. And back in April, there was a positivity rate of those testing positive for the virus. In April, it was at 43%. And as of July 29th, it was at 5.8%. That's a huge, dramatic decrease in the number of cases that were testing positively. But we did see a spike, and that's not a good thing. We saw a spike as we saw the numbers coming down from April. We saw a spike right after July 4th because more than likely, I think we can all surmise that people were out and about much more and at times congregating in ways that are not healthy and that do not protect and stem the spread of the virus. So we all know from the science what we need to do to help stem the spread of the virus. We also know that the infection rate, and I'm speaking to data, the infection rate is around the median, just below the median in Maryland at 1.11. And that what that says is we're not above what's happening across the state. We're just below the average in Prince George's County with regard to, in Maryland, with regard to the infection rate. So the numbers are telling us that things aren't great. The virus is here. Everybody needs to accept. We all accept the virus is here. But what we are doing to the extent possible is everything we can to help mitigate the spread of the virus, to protect our campus community. And we need to, as a larger community, do what we can to bring down the spread and flatten the curve of the virus. And so once again, I want to remind everyone, the decision-making is science-informed, data-driven, and values-based. And before I go on to values-based, I want to talk a little bit about the data a little bit more, because so many people in our prior town halls have asked about the number of cases, the infection rate, and the spread of the virus. There's another impact of the virus that we all need to be concerned about, and that is the mental and emotional well-being, and being informed about the data with respect to the impact of COVID-19, because the COVID-19 impact isn't just a physical impact. Staying at home, being isolated, not being able to socialize with your friends and your family, that has its own impact, and it has had a disparate impact on the African American community and on our age group, our traditional age group of students. And that is another factor that has led to the decision to try, to the extent possible, to bring some students back to the campus, namely our first year students, to make sure that at least they connect with our university, that they are not self-isolating at home. And we know that some students don't learn well in this virtual world. So where it is possible and safe to do so, we are bringing back some students with an emphasis on the first year students so that they can connect with their peers, so that they can connect with their faculty. Because research tells us, the data tells us, that students will do better if they are able to connect with a faculty member, connect with their peers, and not be isolating. The data tells us, even pre-COVID-19, that our African American adolescent, college age, traditional college age students are suffering at a significant impact in comparison to other students, other racial groups. And it is more impacted, that phenomena is more greatly impacted by COVID-19. And so that's what has led the American Pediatric Academy to issue a guidance order for older teens and children, stressing the fundamental role of our schools in providing academic instruction, social and emotional skills, safety, nutrition, physical activity, and mental health therapy for students, and recognizing the role that schools and universities play in the lives of our students. They need to come to the campus, not just for the learning and the academic mission, but for all of the other supports that we provide to our students. So when I'm asked, well, why would we want to bring any students back to the campus? I come to that third point, values-based, and being accountable for providing access and the way forward for our students to have the necessary supports that they need to be successful. And that includes providing access to education and access to the support systems that they need, their peers, connecting with faculty, connecting with our campus, especially as an HBCU, the first HBCU in the state of Maryland, and making sure that our students, they get that access to what we have provided for over 150 years. And that's that wrapping around that we do of our students and giving them virtual or real hugs that let them know that we are here for them on their journey forward to achieve their educational goals. And that includes providing those other supports. And then finally, on that note, I want to acknowledge that not all of our students have the at-home environments that are supportive of their learning, and that some come from environments where they have other siblings, they have other conditions at home that distract them from their learning and are not supportive. And they're different home environments that detract from their learning. And then secondly, some come from environments that are not safe. Some come from environments that do not provide the proper nutrition. And you all know that, I hope you know, that last year we opened up the Food and Nutrition Lounge to support our students who are facing food insecurity. We recognize that we have a growing population of students who are homeless. Last year we had 14 students who identified as homeless. Those are the ones who identified themselves, because there is still a stigma around that. And for all of these students who either don't learn well in this virtual environment, or those students who are struggling because of distractions at home or safety issues at home, or are lacking in the supports they need, we want to do whatever we can, to the extent that it is safe to do so, to give them more of an experience on campus if we can. And so we have, for those students who may, are upper class students who may be learning virtually because most of our students will still be learning virtually in this new academic year. We have accommodated some of our students with additional housing off campus in local apartments where we will have staff monitoring them, supporting them in those locations, because although they may not be able to come to the classroom to learn, we want them to have safe spaces where they can at least study and be away from the other conditions they may have so that they can stay focused on their learning. Next slide, please. So these are the guiding principles, and these are posted on our website. We start with safety first. That's the #1 goal in this model as we plan for the future. We have to address safety first. Next, we have an emphasis on shared governance, and I mentioned the 25 groups that are working very hard to prepare for the opening and the return of first-year students to the campus, and for most of our students to continue learning virtually. And that comes with a lot of preparation, and there are almost 100 people working in this endeavor with the 25 working groups. Thank you to the staff, thank you to the faculty, thank you to the students who are represented through their shared governance groups who are on these working teams and pulling all these different components together. Next, we continue to race to excellence. We stay focused on providing a commitment to excellence, and we will continue to do that throughout whatever come what may, whether it be the issues with the crisis of COVID-19 or facing the social systemic racism, the social injustices in this country. We are going to be committed to providing excellence in everything that we do. That's where we will remain focused. And then finally, we will adhere to a standard of care and providing a plan that requires strict compliance with the state and federal laws. And so recently you have received an announcement indicating that you must wear your mask if you are coming to the campus. We have guidance from our system and in collaboration and with an intent to keep our campus safe. We will be talking today about testing and what is required for anyone coming back to the campus and what is required with testing. We will talk about testing, tracing, should we have a case on campus, and then the precautions that are in place to help protect our campus and mitigate the risk to our campus. But we will continue to adhere to the state and federal laws, as well as observing the regulations and executive orders and staying in compliance with any other regulations that we are required to do through the state and federal, as well as with our public health officials. And I'm very pleased and thankful that we have representation on our working groups from the public health department that has been helping to inform our decisions around that top priority and the principle of health and safety. And so I want to make sure that you understand that there is a rhyme and reason to how we're moving forward, that we are not being arbitrary in our decision making, and we are taking in, we as the administration are taking in a lot of information to guide the decision making and adhering to the laws and regulations, but practicing the first principle, and that's health and safety. And so with that, I'd like to now ask that Mr. Wade Henley speak to the measures that are being taken to address sanitation and safety precautions. And so Mr. Henley, is now my honor to introduce you and turn the microphone and the program over to you as one of our campus project managers, along with Ms. Donita Smith, who I know is on the call, working closely with Dr. Rita Wuta and Dr. Demetrius Johnson. Mr. Henley, the mic is yours.
Thank you, Dr. Breaux. Good morning. I'd like to go over the sanitation process and the safety precautions we have taken as we return to campus. First of all, the ABM sanitation process What I'm going to do is I'm going to do a comparison of pre-COVID conditions versus post-COVID conditions once COVID has taken place here. And with that, our protocol or schedule that under the pre-COVID conditions, the restrooms were cleaned twice per shift. That means clean once every 4 hours, roughly. So first, let me tell you what a shift is for ABM. That is Monday through Friday, 7 a.m. to 3:30 p.m. would be the day shift. And then 3 p.m. to 11:30 p.m. would be their night shift. So again, restrooms clean twice per shift under pre-COVID, but under post-COVID now, restrooms will be cleaned a minimum of 4 times per shift, or roughly cleaned once every 2 hours. The common areas were cleaned twice per shift under pre-COVID, but under post-COVID, again, a minimum of 4 times per shift. I say minimum because should we find that we need to do it more often, we will. Then under general housekeeping, that stays the same, both pre-COVID versus post-COVID. But general housekeeping, what does that include? That includes vacuuming, which is done roughly 2 times per week, dusting daily, and taking out trash. However, under post-COVID conditions, high touch points will be cleaned a minimum of 4 times per shift. So what are these high touch points? Those would include door handles, countertops, elevator buttons, and lobby entrances. We will also clean and sanitize each classroom and/or professor station in between classes. As far as protective gear, under pre-COVID, you would see ABM workers walking around with single layer dust masks, and they would wear them as needed. Now, under post-COVID, they are required to wear a triple layer cloth mask. Also, when they are spraying, they will wear an N95 mask. I'll get into spraying a little bit later. Under pre-COVID, they will wear gloves as needed. However, under post-COVID, they are required. Under pre-COVID, goggles were worn as needed, and that will remain the same under post-COVID. Next slide. As far as the cleaning products used, under pre-COVID, Clorox wipes were used as the primary wipes. However, under post-COVID, Oxivir wipes will be the primary wipes used. Those are disinfecting wipes recommended by the CDC. The difference between Oxivir and Clorox wipes, Oxivir wipes will have a 1-minute kill rate for the COVID-19 virus. However, Clorox wipes have a 4-minute kill rate. As far as the cleaning solutions used for the restrooms, that will stay the same. And we will also have the same multi-purpose cleanser from Green Laundress. As far as spraying is concerned, we will use electrostatic antivirus sprayers. And as far as the antivirus solution, that will be the PerTabs 3.3G, if you want to look that up. As far as our spraying that will take place, that will be done on a daily basis. However, it will only be done in unoccupied buildings and in the evening. The schedule for that will be Monday through Friday, 3 p.m. to 11:30 p.m. and Sunday through Thursday, 9 p.m. to 5:30 a.m. Again, only in unoccupied buildings. Next slide. Thank you. And as far as additional safety precautions that we're taking, we have changed all HVAC, which is heating, ventilation, and air conditioning, air filters, and adjusted the HVAC air intake control to maximize the amount of fresh air coming into buildings. However, this will also mean it may be a little warmer on a very hot day. To give you an idea of what's taking place, I will use MLK as an example. Under normal conditions, the air intake was set at 10% outside air. Now it's up to 40%, it's a minimum of 40% outside air. So again, you can see why on a very hot day, it's going to take quite a bit to ever get it very cool. So it may be just a little warm, but that's a small price to pay. Also, I want to bring note while talking about MLK, Because of the issues that have existed at MLK, we'll be taking additional measures with that building, and we will be working with the people who have offices there to take a look at additional measures that we can take. As far as the signage program, we have an extensive signage program where we have identified the capacity with social distancing of every classroom, event rooms, conference rooms, in every building, elevators, as well as restrooms. We will be switching over from temporary signs to permanent signs shortly. Directional signage is included because where possible, doors will be used for either entry or exit, but not both. And what you see before you is an example of a paw print that's used for social distancing. Administrative assistants and reception areas have had an added layer of protection with acrylic and/or plexiglass shields. That example there is Dr. Bro's reception area. And then protective plexiglass screens for professors' workstations will be custom fabricated for in-person classes. The screens will be configured for each individual classroom. Next slide, thank you. And classrooms with attendance approaching 50 people will have temperature kiosks for students to use upon entering. The kiosk will have an audible alarm and a visual status to let you know if your temperature is fine. And we will have these kiosks staffed for verification of use. Now, what you see there is I stood before one of the kiosks that's here in the Student Center. We will have these kiosks in the Student Center as well as the library. And there, I know it's hard to see, but it actually says access granted. That's what's in green. And right below that actually has my temperature for that day. We also have a rapid response protocol, which is in place for when we learn of a possible COVID-19 case on campus. We will cordon off the area and sanitize it. A special company has been retained to sanitize within 4 to 8 hours of notification, depending upon the area. And depending upon the area, we will try our very best to make accommodations while that area is being sanitized, meaning we'll try to make sure that you're able to keep that event going or that classroom going in some form or fashion. And finally, we want to make sure that you notify us should any issues come up. We have tried to think of everything, but we also realize that some fine tuning may be necessary when people are actually on campus working in their offices. So if there are additional needs, we will consult with you to make these modifications. Notify us, but first notify your chain of command. Let your supervisor know first, but then after that, contact Daryl Williford, or you can contact me, or you can write to covid19@bowiestate.edu. Thank you. Ms. Jones?
Thank you, Mr. Henley. I would like to now turn our program to the portion of the Q&A section. And I would like to begin with the first question, commonly asked question regarding COVID cases and the steps on campus that are being taken. I would like to direct this first question to Dr. Johnson. Dr. Johnson?
Ms. Jones, thank you so very much, and welcome to the Bowie State University staff in our town hall meeting. My name is Demetrius Johnson. I serve as the Vice President for Student Affairs, and I began on June 15th. I'm excited to be here at Bowie and looking forward to getting to know each one of you. Related to our next slide, our president has outlined that we will be informed by our science, that we will make decisions that are data-driven in line with our values. And although you hear a lot of national news about cases and positivity rates, it's important to center our efforts here in the Prince George's County information. And so what you have in front of you now is a chart that looks at the positivity rate. And the president alluded to this earlier in her remarks, that back in April, the week of April 19th through the week of April the 25th, the positivity rate was 43%. That means that of those tested in Prince George's County, 43% of those folks, the results came back positive. If you go down the chart, you will see last week, the week of 7/19 through 7/25, that the positivity rate was 5.8%. And so when you hear the news that in Prince George's County, that our numbers and positivity rate are increasing, that is accurate. That we have gone from, if you look at the chart, 5.3% to 5.8%. That, of course, is nowhere near the 43% that we were experiencing back in April. Regarding our efforts on campus, I wanted to distinguish among four things. First, as you arrive to campus and even prior, you've received an email asking you to participate in symptom monitoring. That is the online form that you use, I use, all of our community uses daily. This 15-question survey provides a comprehensive daily snapshot of the overall well-being of those working on campus and those members of our community who are also teleworking. Screening would occur in various locations throughout campus, as Mr. Henley mentioned, by kiosks and sometimes by personnel, by taking temperatures and directing our community to complete the daily system monitor link. For testing, it's important to remind this group that you received an email yesterday saying that faculty and staff, in response to the mandate that has come through our system, may achieve free testing on our campus Wednesday and Thursday of this week in order to support and help comply with our return to work orders on August the 10th. Please note that as you upload this information to Human Resources, that if you have taken a test but you don't have results, that's okay. Please just upload proof that you've actually taken the test. And if you do that here on campus by signing up, we will facilitate that process for you. Please sign up. Please do not arrive without signing up to make certain that we can handle all the people kind of in line. Finally, I wanted to mention to you that not only are faculty and staff being offered testing, but our commuter students will be offered testing on the 18th, the 24th, and the 25th. And all residential students will be tested 14 days prior to arriving on their own, but also when they arrive to campus to move into our residence hall, they will receive a second test performed by our wellness center. All of this is to deal with what's happening in the county, but also to keep our campus safe and secure. Ms. Jones?
Thank you, Dr. Johnson. I would like to remind you that at this time you may submit your questions in the Q&A. Our first question that was previously submitted is a two-part question. Could you clarify who has to complete the daily health survey? Why is it necessary for those who are approved for teleworking 100% of their time to be tested and complete the daily screening if they are never on campus? Dr. Brown?
Actually, I'll ask Dr. Johnson to address that question in the protocol and to clarify. Thank you.
Thank you so much for that question. In line with our values at Bowie State University, we want to be inclusive. As you've listened to the remarks of our president, all of our faculty, staff, and students are important to us. For those who are teleworking, the snapshot on a daily basis provides a comprehensive health and well-being of our entire campus. If someone is teleworking and becomes infected with COVID-19, the university still, through Dr. Rita Wutaw, will reach out to you to make certain that your medical cares are being taken care of, and honestly, to make certain that you are okay. In addition, while people are approved to telework, there are times where people will come to campus to grab a file or a folder or to drop things off, and making certain that we have a good comprehensive picture of the health and well-being of our entire Bowie community will be important to mitigate the risk of infection, even if teleworking people simply come to campus on an irregular basis. Related to who needs to be tested, I arrived at Bowie State University on June 15th. I arrived to work, non-telework, on June 29th. Prior to that date, I myself was tested, and I tested negative. This order that has now come through our chancellor for our entire system requires that I test again, that prior to the return to work on the 10th of August, I should, as all of us should, either test ourselves locally at some of the facilities that are listed on our website, or sign up for the free testing that is being offered on our campus. If we are all tested, if we all know our status, we can make better decisions about how we interact with others or the necessity to quarantine. I hope that answers that question, and thank you for it.
Thank you, Dr. Johnson. Our next question is, how is the information for the daily screening being used, and how is the HIPAA compliance for access to these daily surveys being assured? Dr. Bro?
I'm going to allow Dr. Johnson to keep going. Sounds like most of these questions may be in your realm. So Dr. Johnson, once again.
So our infrastructure supports our priorities. Microsoft Teams is actually HIPAA compliant. We will use Microsoft Teams to perform some of our psychological interventions with students. Some of our counselors will use Microsoft Teams. And so we are HIPAA compliant through Microsoft Teams. In addition to that, our online screening data is shared in the aggregate with Human Resources as well as Dr. Rita Wuta, so that we have a comprehensive snapshot of the health and well-being of our campus on any given day. Should some symptom arise, the logic in the form notifies Dr. Rita Wuta, a medical doctor who is, of course, compliant with both her background and training and license, to provide an outreach to that staff member or faculty or student that is honoring both confidentiality for the institution as well as her license. And so no data is transmitted in a way that is outside of the compliance of HIPAA, and the information for a positive COVID test is shared with a medical doctor, Dr. Rita Wuta.
Thank you, Dr. Johnson. The next question, will there be a daily announcement of the confirmed cases reported on campus?
There will not be a daily announcement of confirmed cases. We will follow the same protocol that we did back in the spring. And you may recall when we had a report of cases, we were providing that information on a weekly basis. As I mentioned earlier, we do have a weekly announcement going out on Wednesdays. And so you would expect to see that information, the number of cases, no names, of course, and no other information. Anytime we, back in the spring when we had such reports, that information is then addressed by the public health department, and they go through the contact tracing to ensure that any individuals who came in contact with someone who tested positive is notified immediately. So the communication will go out on a weekly basis rather than on a daily basis.
Thank you, Dr. Bro. Our next question. What if you are uncomfortable coming into the office, but your supervisor says you have to come in? Originally, we were told that you couldn't make testing mandatory. What changed to make testing mandatory? Dr. Bro?
So that's a two-part question. I believe we have Mr. Savia on the line. If he is, I will ask him to take the first part of that, and then the second part with testing. Let me then defer to Dr. Johnson with regard to part two.
Yeah. Good morning, everybody. Thank you, Dr. Bro. Yes, to address that first part of the question, we are there is a guide that has been provided to all supervisors, all department chairs, all deans, directors. It's about a 9-page document. It is posted on Human Resources website. You're more than welcome to take a look at that, the guide. And what it does is it asks all supervisors to work with employees to set up their schedule, either teleworking or working on campus. Some jobs do require, some positions do require individuals to be on campus. we will do everything we can to ensure that safety. That includes gloves where necessary, face coverings where necessary, social distancing where necessary, staggering the schedules where necessary. So different protocols will take place and have been taking place for anybody who is required to, their job requires them to physically be on campus. Also, keep in mind, we have students that will be returning, so it will require staff to be there to actually to work with students and to address any concerns they may have. In that document that I just referred to, there are different circumstances. If an individual falls within certain categories, can work with their supervisor on teleworking and other means of utilizing their leave if necessary, utilizing the First CARES Response Act for response. There are certain items that fall within that category where an individual may qualify for. So it really is up to it's on a case-by-case basis. So I encourage you to work with your supervisor. If you run into any issues with that, please reach out to Human Resources. Sheila Hobson and Deborah Humphreys are available to work with you on those individual cases and try to address that, the situation.
Let me then start off on the second part of, thank you, Mr. Savia. Start off on the second part of that question with regard to what changed. Throughout each week, 3 times a week, each of the universities across the University System of Maryland are in a virtual meeting talking with the chancellor and the staff at USM and sharing best practices to the extent one can have best practices through this new normal. We're sharing information about what is in the best interest of our campuses in mitigating the risk, the safety risk, and the spread of the virus. And one of the discussions, and several discussions have been underway to ensure that we understand before we bring people back to the campus where they are, helping individuals to have the knowledge they need to understand if they are putting the campus at any greater risk before they come to the campus. So that's one of the things that we have discussed across the system about the need to collect and help individuals assess where are you at this given time. And so we wanted to make sure that to the extent possible, each individual who is looking to come back to the campus has the data you need to make informed decisions. So that's one of the things that when you're asking, well, what changed? It's the recognition that we need to arm individuals with the information you need to make a decision as to whether you should be coming to the campus. This system we have in place for self-monitoring, it is on the honor code system. It is asking you, please do what you can to keep our campus safe. You know, no one's in your home watching you over your back saying, are you filling this thing out accurately? We're asking you, every member of our campus community, to do what you need to do to bring down the risk to the campus. And that starts with you getting a test and assessing whether you need to decide, I'm going to stay away from the campus today or not, and report that through that self-monitoring system. So the second part is to also help us get a baseline as to where we are when we start the year, collecting data to find out, you know, are 50% of our staff members not able to come to campus because they tested positive. That's collecting data that informs us. I go back to how we're making decisions and understanding, well, what are the data points? You know, where are our employees at this point in time? So the data is extremely important. And this is what Dr. Johnson was explaining with regard to the last question. It helps inform us about which course to take, depending on what's happening with our faculty, our staff, our students. So we're collecting information to be able to assess, are we on track, on the right road for this plan, and continuing to improve upon our policies, our protocols, and our procedures. So that would be my answer to the second part. And I don't know if Dr. Johnson, you want to add anything further beyond that.
I would, thank you, Dr. Bro. Thank you, Dr. Bro. I would just add that Bowie has responded very fast to the requirement for faculty staff to be tested. And one of the priorities of responding so quickly is to make certain that faculty and staff did not experience difficulty in obtaining these tests. That's why on Wednesday and Thursday of this week, Bowie State University will be offering for free testing for faculty and staff who sign up in order to make certain that we can give you both so that you can comply with what we are all in compliance with, but beyond that, so that you have personal health information. There are a number of people throughout our country and certainly in Prince George's County and on the campus of Bowie State University that may be asymptomatic and may not know that they have the virus because they have no symptoms. And so persuading people that feel fine to take their health seriously is a part of the strategy. If we can, in exchange for the kind of work that people do that makes Bowie State University great, if we can respond rapidly so that this is not a burden, I'm very, very proud that we've done that and encourage people to visit our website for the free resources throughout the DMV area, as well as to take advantage of the free testing provided by Bowie State University on Wednesday and Thursday.
Thank you for adding that on. And by the way, I tested out our protocol as I have with each of our protocols that are in place so that I understand how they're working and making sure that it is effective and it is meaningful in terms of how we're setting these protocols up. And I went online to schedule a time for that testing for tomorrow, and it was very easy to do. It took less than 2 minutes to schedule a time for that testing. This would be my second time being tested, but I wanted to test the protocol on our campus, and it works very easily. So just an easy process. So kudos to our team who put that together. And I encourage everyone in listening ear who's on this call today, please make sure that you are going for your test. The county has done an outstanding job in providing testing sites around Prince George's County. Please do what you can to get your test so that we can help you understand where you are with this virus. It is here and it has not gone away. And it's important you have the essential information to help you make important decisions. Next question, please.
Actually, Dr. Bro, really quick, I just wanted to follow up a little bit more on the on that first part of the question. One thing I forgot to mention that we've talked about in the past is, in addition to everything that Mr. Henley has talked about as the safety precautions, the cleaning precautions, and other things, we also, when you return to work, you also receive a packet. And in that packet will include hand sanitizer, gloves, a mask, the thermometer, things that you need, and in your workstation. So it's very important to know that all different types of precautions are being taken for the campus to ensure your safety. In addition, I talked about the return to campus, working with your supervisor. So far, Human Resources has had, I believe, 3 different Q&A sessions, and they will continue to have those. So I encourage you to participate in those sessions so that you can be informed about the different things that are available to you. So thank you, Dr. Bro.
Thank you. Our next question is, if I was already approved to work on campus during phase 1, do I now have to wait until I get tested and receive a negative result before I can continue to work on campus? Dr. Bro?
I think Mr. Savvy or Dr. Johnson can take that question.
Thank you, Dr. Bro. Thank you, Dr. Bro. Happy to tag team with my colleague. The short answer is yes, that you will need to test again. But recall that simply testing and uploading that you have complied is enough. We recognize that faculty and staff are not in control of when you get your results. So if you go online and sign up for a Wednesday or Thursday on our campus, we will facilitate the notification process for you. If those 2 days are not convenient, again, we have on our website indicated places around the DMV where you can go be tested. As long as you can simply upload that it has occurred, then you will be just fine. If you need individual flexibility, you can certainly reach out to me or Mr. Savia, and we can certainly work with whoever has that question. But generally speaking, this helps protect all of us, and we've tried to make it easy, and so I hope that helps.
And I just want to reinforce that I too went online this morning and scheduled my appointment. Last month I was tested, everything was fine, but I went online this morning and I have an appointment on Thursday with the Wellness Center in order to be tested again. It was extremely easy and simple. Received a notification once it was scheduled, so I do encourage everybody to take advantage of that.
And Dr. Bro, if I might, just quickly, to be specific, there are some of us who have been tested once and we're coming for our second test. The test that you will receive here on our campus is not an antibody test. It is not testing to see whether you've had it in the past. It is a test that is indicating whether you have the virus active in your body right now. In addition to that, it is not performed by medical personnel who may go very far in your nose. We have the self-administered nasal swab test that will be done by the patient. That provides an opportunity not to go as far, to do multiple swabs of your nose to get a good sample, a good specimen. And so this is one where you are much more in control. It is a touch less intrusive. And again, it's an easy sign up here at Bowie State University so that we can all be safe. Thank you, Dr. Bro.
I think it's important to note, although these are two different ways you can be tested, as you just described, what we are doing is still FDA approved, and yes. It is okay. It has validity. It's important to note that.
I think Dr. Bro is exactly right. The decision was made at the institution to forego some of the faster, more rapid response tests that have not received FDA approval. They've received FDA endorsement, but not approval, which is a more rigorous process. We will only use FDA approved science in order to keep our community safe.
Thank you. Ms. Jones?
Thank you. Dr. Bro, this next question was directed towards Mr. Henley, but I will still redirect to you first. It states, Mr. Henley, I have been working in the library since February, and I have never seen anyone clean or vacuum since I've been there. All they do is empty the trash. Dr. Bro or Mr. Henley?
I think there's two individuals. I'll ask Mr. Henley to start, but Mr. Savvy, I'll ask that you address that as well.
Okay. First of all, obviously that should not be the case, and I need to follow up with ABM to find out what is going on. That needs to be corrected immediately.
What we will do, ABM is, as they go around the campus and they're going through these protocols, they're required to sign off on a certain sheets that let you know whether they have been in that area. And so we will look into this because there is supervision and there's monitoring, and I'm surprised to hear that. And so we will look into that immediately and make sure that where they are signing off saying that they have done what they're supposed to do, that there is oversight for ABM during this time, especially in this area. So if you could do me a favor, the person who wrote that comment in, if you can be more precise and give us a location on COVID-19 at bowiestate.edu, that is an email address where you can send any complaints, and I invite anyone on this call, if you know of any circumstances where what we have described is not happening for you, please use that email and let us know what's going on, and we will address it immediately. Mr. Savia?
Yes, yeah, thank you. Thank you, Dr. Bro and Mr. Henley. And I too would like to know specifically the area, what's, of where you're referring to in the library. It's very helpful for us. I can share with you, there are the protocols in place, as Dr. Bro mentioned. We also, the campus did have a thorough deep cleaning, the entire campus, over spring break when we were closed. So there are times you may not even see ABM on campus or the times when they are cleaning. So I know that that has happened. We have also, it's important, I think this goes back to an earlier question about the screening or knowing people who are teleworking versus people on campus, so that we know where people are located on campus, so we can ensure that those areas are receiving the proper cleaning that is required. So we're trying to do this and capture all those areas through different mechanisms. So please let me know what area in the library so we can address that. But also please know that there are times when cleaning is occurring, you just don't know that, and it's occurring at different hours now. It's not the normal, and it hasn't been the normal cleaning schedule for them.
Thank you.
Thank you. Our next question is, how will BSU monitor and inform visitors of the safety requirements before and upon arrival on campus from the MARC train? Dr. Bro?
All right, I think we probably can go to Dr. Johnson or any of the other cabinet members who have been addressing that, but I'll start with Dr. Johnson.
Thank you, Dr. Bro. The perimeter that we have set up does direct vehicular traffic through the guardhouse as a way to both control traffic and monitor for the safety of our community. There are also members of our campus safety team who are on foot on campus with a specific station by the MARC train to be able to intercept people who are taking the MARC train and coming to campus. In terms of information, every Wednesday, all faculty, staff, and students and incoming students receive written communication about any changes, updates in our policy, and our marketing communications office has created a broad, comprehensive signage campaign being implemented in the next couple of days that will post on every door, buildings across campus, to make certain that any visitor and every visitor understands our mask wearing mandate, as well as all of our safety procedures. So campus safety at the perimeter, communications that go out weekly, and signage across campus to inform visitors.
Anything more to add from any other cabinet members? I think that's a good comprehensive answer, Ms. Jones.
Thank you. Our next question is, if I just want to run into my office to grab a few things, do I need to get tested and receive a negative result before I come?
There is a protocol to follow, and Dr. Johnson, you want to go back over that protocol once again?
So remember that all members of our community will participate in the daily symptom monitoring through the link. And so all staff are reminded to please perform that function on a daily basis. We also have testing set up today and tomorrow so that we alleviate the question of whether or not I am positive or negative. We're hoping to provide good support so that not only about running back and forth to Bowie State, but in your own personal life to have information whether you are asymptomatic or not. Thirdly, if you come to campus and you have not performed those functions, you will be stopped along the perimeter by campus safety, and you will be screened. And if people recall, that is a temperature check, some questions based on the symptom monitoring form. And if you are not symptomatic, if you are asymptomatic, you will be provided a wristband so that you can access campus for a short duration of time and then leave campus. I hope that answered your question.
I think the latter part was the key part of the answer, and that is if someone decides on a given day, oops, I forgot something in my office, I need to go in on that day, they're asking what do they need to do. They are they prohibited because they didn't get a test on in the last 10 days, and your answer is no. But if you follow this protocol, you should have been screened or you had a test some time ago. And you also would be monitoring, doing the symptom monitoring. And so when you arrive on campus, you won't have a temperature. And as such, you can go as a visitor, get a wristband, and be allowed into your office.
Yes, that is correct.
Thank you.
Thank you. Our next question is, since phase 2 has been pushed back to start August 10th to do mandatory testing for COVID-19, does this mean that the dates of return to campus has changed as well? The previous dates shared by Mr. Enderle were August 3rd and August 10th. Is it possible to be scheduled to return later, like August 17th?
All right. With regard to, I'm not sure about those dates that were just cited. I would, let me just remind everyone that I'll ask Mr. Henley and then Mr. Savia to weigh in. When I hear return to campus, they're referring to the phasing in. I want to remind everyone before I turn the mic over to Mr. Henley, Mr. Savia, that our students are scheduled to arrive our classes start August 31st. Move-in day is August 17th. And so leading up to that, there are some dates of when we're phasing in employees to get ready and anticipate those arrivals. With the phasing in, I will now turn that question in to the pushback on those dates to Mr. Henley, Mr. Savia, and Dr. Johnson, if you also want to weigh in. But let's start with Mr. Henley.
Thank you. So originally the dates were the 3rd and the 10th, meaning starting on August 3rd, we wanted to make sure that all supervisors had scheduled their employees to start work. That did not mean that you would actually come to campus on August 3rd. Keeping in mind, we didn't want more than 50% of any office in on any given day. But over that 10-day period from August 3rd all the way to for those 2 weeks, the week of August 3rd as well as the week of August 10th, those 10 days that you would be scheduled in the office for at least 5 days, therefore giving enough time for you to be prepared for the students returning on August 17th. Once that was moved to the 10th, we now have a little bit of a crunch. First of all, you should have still been scheduled, that you should have an idea of what your schedule will be, basically over a 2-week period. Now the issue is, yes, that August 3rd date has been moved to the 10th, but that does not change the fact that we have to be prepared for the students coming back on August 17th. So this is an issue dealing with the supervisors, making sure that your office is ready for the students on August 17th. We don't want our students starting off at Bowie State having an unpleasant experience.
Right. That's right. That's right. And to follow up to what Mr. Henley was just saying, these dates are when the supervisor should have been working with employees on their schedule for either telework or working physically on campus. This means the administrative leave that people have been on, or some people have been on for the past couple of months, is actually going away. So it's been pushed back until this coming Monday. But as of this coming Monday, all employees are either teleworking or they're working on campus, or they fall into one of these categories that I was describing in that document that's on the website that supervisors have to talk about whether or not they are actually able to work, whether they have certain circumstances at home, they're caring for an individual who has COVID. There are different rules that kick in for employees, whether they use their leave or they may qualify for some of the federal leave or something. So it's on a case-by-case basis. But so the only thing that's shifting, the opening dates aren't shifting, and the starting dates of the students returning aren't shifting. This is your scheduling with your supervisor. So as of Monday, all employees, again, will either be teleworking or working on campus unless they have made other arrangements with their supervisors. So hopefully that has made some sense. And again, I encourage you to, when HR will continue to have their Q&A sessions and such, please sign up to watch those as well.
Thank you. Our next question is, why do we have to type department and telephone number every day?
Into the protocol. Because I have to do it too. That is part of the protocol. Mr. Henley, or Dr. Johnson, do you want to address that? We continue to make some tweaks to it, but I'll leave Mr. Henley to start that answer.
Because this was a system that we built here at Bowie State, we've been making modifications along the way. So we do realize that this is an issue. We will put a little bit more time and effort into this to have it to be less burdensome on you. So we do recognize this. There are more additions or versions to come to make it easier.
I would also say,
go ahead.
Yes, ma'am. I would also say that what that would require, and I'll segue for my colleague likely, is it would require that we capture and save your information so that when you pulled it up, it would auto-populate, right? The reason it does that on our computers is because that information has been saved. In order to get aggregate information, and only specific information if a person needs medical follow-up, it does not auto-populate. And so what you are receiving every day is a fresh link. Your data is not being saved and stored in a way based on what I talked about earlier, based on confidentiality and HIPAA, in order to auto-populate. It's a fresh form. You're sending in fresh data every morning. The only people that we need to save that medical information is for folks with whom we have to do a follow-up. And that happens based on how you click the different radio buttons.
And President Bro, this is Maravik. I also wanted to add to what Dr. Johnson is saying, that it is important we capture that phone number in the event that for that day, your contact number might have changed from your previous numbers, and that it would be a fast way for, Dr. Wuta to reach the person in the event that that she does have to because of the answers to questions.
Thank you.
Thank you. Our next question is, are faculty who are currently on semester break, example, not required to be on campus or telework during this period, still required to take the COVID screening survey posted by the Wellness Center? The service community portal keeps sending a list of faculty who have not completed the daily screening survey. Dr. Brown?
I'm trying to, well, first of all, let me turn the question over to Dr. Johnson. And we also have Dr. Goodman, who's on the line. And I want to, I believe he was able to join us, our new provost. I know he had a meeting. He was going to try to join us, but I'll ask Dr. Johnson to start that answer, please.
Related to faculty who may be on sabbatical or break, I appreciate that feedback, and we'll work with the DIT team to see if there's a way to screen that out. I think that was the thrust of the question, whether or not people who are not here, i.e. on leave or break or sabbatical, whether they should still be getting the form. And so I'll have DIT talk with me about that and see if that's an improvement that we need to make. Thank you for that question.
And let me
Dr.
also,
Goodman, are you on the line? Oh, you are
Yes.
on the line.
Yep.
Thank you.
and
I'm
also
glad
let
you
me
were
add,
able to join us.
no problem. Let me also add that again, I mean, as far as the faculty who are on leave, we did get that question raised to us actually yesterday. And so we were going to send information over to DIT as well. But as far as the faculty are concerned who are really working or teleworking, I think as Dr. Johnson had mentioned earlier, I want to make sure that all the faculty are accustomed to monitoring themselves on a daily basis prior to the start of the semester, since they are working now for the most part.
As I mentioned, there's a lot of work going on throughout this time period with the working groups that are planning for the return to campus. And that includes a lot of effort by the faculty over the summer who are working on improvement to the delivery of their classes virtually, working with instructional designers. So a lot of efforts going on. But again, for those faculty who are totally on leave, I think those are good responses in terms of preparation for the opening and startup to the fall semester. To get everyone into practice, as you heard me say, and Dr. Johnson and others, we have been following these protocols. We are testing them out and making sure that we're in that rhythm and doing this work because we each have to take that individual responsibility to make sure that we're taking the proper action and filling out that form as well. And so it's not just something we're saying others need to do, but we are going through this too in order to shape the culture of personal responsibility in order to stem the spread of the virus. So thank you for that question and for those answers.
Thank you. The next question, if we can come on campus without having our test results, how do we know we are not coming on campus and infecting others?
Well, I would start with, again, there is a process you're going through. As you've heard Dr. Johnson say earlier, that we are expecting that everyone is taking responsibility for getting a test, whether you're coming onto the campus or not. We are asking that you fill out the symptom monitoring and that you take personal responsibility for reporting if you have any of the symptoms of the virus. And that includes a high fever, coughing, muscle aches. These are the questions that you're being asked about on that daily monitoring form. And then if you do need to come to the campus, you then have to go through a temperature check. And so there are these protocols in place. And once you get onto the campus, we've already discussed, you must wear a mask. We know that that helps with you spreading the virus, and it does give a layer of protection should you come into contact with anyone in your area. And then finally, you heard earlier in the presentation that anyone who is coming to campus, the reason we're going through all of this and identifying who's on the campus is that there is sanitation that's happening. If we have been tracking who's going into which building. So if we know that you are visiting, you're picking up a piece of equipment or something you left behind, we know that you've been in that space and that space is to be cleaned and sanitized. That's the protocol in its entirety in respect to this question. And thank you.
Thank you. The next question. I'm sorry, my screen skipped. Is there a concern about freshman students being the only students residing in the residence halls without guidance from upperclassmen? Who will be on campus to assist with their growth from high school students to responsible college men and women? Dr. Brown?
Well, let me start out and then I'll ask Dr. Johnson to step in and add anything further. Once again, we have working groups that are addressing the experience, a number of issues, including the experience for our first year students. And I think Dr. Goodman can add more information in here too. We're looking at both the curricular aspects of the experience for the first year students and the co-curricular. And that includes activities as well as what happens in the residence halls. Pre-COVID, you've heard me talk a great deal about bridging our learning environments. And what that means is not just thinking of the learning that we impart to the students as happening only in the classroom. We recognize that a great deal of time is spent in the residence halls. And so there is programming that happens in the residence halls pre-COVID-19. We expect that to continue. We expect that there will be ongoing integration from curricular to co-curricular experiences for our first year students. And there are working groups that are working diligently on delivering on the learning, not just in the classroom, virtually in person, but also in the residence halls as well as across the campus through the co-curricular activities. And we're very cognizant of these students coming to campus and not having the same exact experience pre-COVID. And we're not setting that expectation. We're letting the students know, yeah, it's going to be different. And I'll say to you today, it's going to be different. But we still believe in delivering on excellence and quality. And that requires having a good plan and delivering on that plan and executing the plan. And so the plan, I'll ask Dr. Goodman first, if you could talk about the curricular aspects, and then Dr. Johnson, if you could then talk about co-curricular in the residence halls and programming and the staffing. I think you're on mute, Dr. Goodman.
I'm sorry. Yes, one of the things that the faculty and staff have done, and I'm truly amazed at what they've done as far as preparation is concerned, is there's 3 courses that the students will be taking as a hybrid. One is public speaking, the other is health science, and the last one is the freshman seminar. We do have some faculty members who will be teaching those courses as a hybrid. And then we have other graduate students who will also be teaching the other part where the faculty members are strictly teaching remote. As you know, being at a HBCU, really the impact that the faculty have and the interaction they have with their students is an amazing thing. And particularly look at public speaking, you look at the health science as far as, your fundamental health, and then the freshman seminar in terms of just bridging that gap from high school to college are the 3 most important courses I feel are important as far as bridging that gap and also the development from high school to college. We also have various different learning themes that we have. One is on social justice. Another one is in civic responsibility, and the other one is entrepreneurship. And so these are virtual living learning communities that we are providing that will cross the discipline on the various general education courses that are provided. And again, the faculty are involved. There are some interesting things that the activities they are having involved virtually, as well as hopefully, particularly when I look at the civic responsibility, with the time of this election are coming on, where there'll be times where the students will be participating in debating the debates that are going on or are planned for the upcoming months ahead. And so there are numerous things that are going on that I think will be very impactful to our students as far as bridging their time from as a high school student going into college, particularly here at Bowie State University.
Thank you. Dr. Johnson?
Thank you, Dr. Bro and Dr. Goodman. I would mention just briefly a couple of things that are really important. The first is to let the staff know that this work has already begun. Under the leadership of Dr. Brian Clemens and Thomasina Boardley, they have had an explosive year for new student orientation. That students have already said yes to Bowie, have already said yes, they want to be engaged. And Dr. Clemens and Thomasina have really done a phenomenal job with new student orientation. So that process of acclimating them to Bowie, teaching them about Bowie, and helping them be successful, my colleague has already begun. In addition to that, another colleague, Marovic, as well as the president, have often talked about closing the digital divide. And I'll mention that knowing that some of my colleagues may speak about new student orientation and closing the digital divide as a way to continue to interface with students virtually and provide that kind of support. From a student affairs perspective, a couple of things. We will have programs on campus. We will have programs online. We will do live streaming. Next week, we will publish a 10-week calendar of all events, programs for the entire semester. So students don't have to hunt and find it. We're going to hand deliver it right to them at a glance the entire semester. Clubs and organizations have already responded. They too are planning programs and events, both on ground and live stream events. And I do want to take a half a second to clarify who our on-campus housing population includes. 443 first-time freshmen will reside in our traditional halls, Holmes, the Towers, Tubman. 236 upper class students will reside at the Enclave, but also on our main campus at the CMRC, 350 upperclassmen will reside there. And so with all of the clubs and organizations and programming, as well as upper class students who reside with us at the Enclave and on main campus, I think that the social exchange among students that helps students grow, change, and develop is something that we're looking at very strongly, and I'm pleased at the progress we've made so far.
Thank you both, and I'll ask Dr. Clemens, is there anything else you would like to highlight and just make the audience aware of all the work that's been going on through enrollment management? Dr. Clemens, anything more?
No. Good morning, everyone. And no, I don't have anything else to add. I'll just make sure that I will give everyone their kudos for helping us to serve the students in the current environment that we've been forced to help on board these new students, but nothing specific, Dr. Brown.
All right, thank you. And thank you to staff who have helped out with the new student orientation and all the efforts to deliver on the new student orientation and getting the campus ready. And kudos to our staff who have been working on the beautiful changes, the plantings, our landscapers, others who are working so hard behind the scenes during this time. It looks like we're coming up on the hour. I don't know if we have time for one final question.
We do have another question that may not take very long. So I will tell that question at this time. The question is, since we did not use our parking pass for the past semester, will we be required to pay for a new parking pass for this upcoming semester?
I didn't think we could finish this session without having one parking question. So I'm going to give that honor to Mr. Savia. I know it's his favorite topic, and I want him to address that. And I don't, before you address that, but I just note, I know many have been away from the campus, but you know that parking lot was finished as we went into the stay at home. And I hope the campus got that notification that the parking lot was finished, and it looks beautiful. And I hope that one day soon, when it's safe to do so, you'll drop by and take a look at it. Mr. Savia, do you want to address that parking question?
Yeah, I think we all always look forward to the parking questions. And thank you, Dr. Brett, for pointing out the new parking lot, because it does. It's actually I drive by it and I take a look and I just scratch my head because it just looks so nice and fresh, and with the canopies, with the solar panels and such, and the emergency phones are being installed now for the around there, and so it's a great place. Actually, I can probably punt this over to Dr. Johnson, since parking is under his area, so I think we're going to have to tag team the response to this, but it is something that we have talked about. We do recognize that there was that. We did in the springtime, we actually did offer refunds for parking. So anybody who had an automatic withdrawal, those withdrawals did stop from the paycheck, and then others were issued a check refund for the parking. So that was taken care of in the fall. What we haven't finalized yet is what we're going to do the spring. What we haven't done is we haven't finalized the fall yet on what we're going to do, because we do have people parking on campus. Right now, if a student has applied for a parking, that means they know that they're going to be parking on campus. If employees are, so it's something we do need to work out. Like I said, in the springtime, we did refunds, so it is something that we have to work with Dr. Johnson and Parking and the cabinet to make that final decision.
Anything more on that question? All right, so the answer there, stay tuned. I hope we were able today to address most of the questions that are on your mind to help you prepare for the future and the fall semester. I recognize that we don't have all of the answers because this is continuing to be a work in progress as we continue to face the pandemic, this virus. The virus is real. We know that. And to the extent possible, we are working to ensure that we're able to deliver on our promise of education as safely as possible. And I hope what you've heard today is the plan, but more importantly, the rationale, the thinking, the planning, the data, the science that goes into the decision making and why we are where we are today with our plan. I want you to also know that should the data change, should the science change, we do reserve the ability to use as a default position that everyone goes back to a virtual environment. It's not ideal. It's not ideal for our students. It's not ideal for our campus community. But if we face that time, if the data does change and the science changes, then we have the ability, as we've already done in the spring semester, to go to a fully virtual and remote environment. We can do that, but it's not the ideal for our students. And that's where I want us to continue to stay focused on the students and what is in their best interest. And I believe that will be the recipe for as much success as we can garner during this new normal. But know that I appreciate your being on this call today, on this virtual town hall meeting on Teams this morning. I appreciate the work that you do each and every day, whether you are on the campus or you are in a virtual meeting room, wherever you are. I appreciate each and every one of you for what you bring to Bowie State University. I encourage us all to stay together as a community, helping each other, lifting each other up, thinking, and if you're a praying person, then sending up your prayers for each and every one of us as we are facing uncertain times. But I do believe as one community, we're going to get through this. And I thank you for your time today. Please send your additional questions if we didn't get to your question to covid19@bowiestate.edu. Let us know what's on your mind, if there's something more that comes up after this meeting or in the days ahead. Please let us know so that together we can chart the best path forward. Thank you for today. And Ms. Jones, I'll turn this back over to you.
Thank you, Dr. Bro. Thank you to all the staff who were able to join us today. We appreciate your questions. And as Dr. Bro said, please follow her instructions in getting your questions answered that was not addressed today. We thank you for your time. Enjoy the rest of your day.